Good morning. Hello, my name is Cindy Wilson. We are currently in the season where we are experiencing extreme cold weather. Today, I would like to take time to educate you about the risks, causes, and how to avoid and treat hypothermia and recognize the signs of hypothermia, frostbites. Afterwards, we will take a small quiz to test your knowledge on what you've just learned. Overall, take care of yourselves and stay warm during the winter season. The causes and risk factors of hypothermia are exposure to low temperatures, alcohol and drug abuse, homelessness and poverty, chronic medical conditions and certain medications, anorexia, cold water immersion, which death can occur within 15 to 30 minutes in cold water. Stages of hypothermia are mild hypothermia, moderate hypothermia, severe hypothermia, and even death. Mild hypothermia temperatures levels between 95 through 99 degrees Fahrenheit. The symptoms of mild hypothermia between 95 and 97 degrees Fahrenheit are cold sensations, goosebumps, shivering may be mild to severe, hands may become numb and unable to perform complex tasks. The symptoms for hypothermia between 97 and 99 degrees Fahrenheit are normal to experience your body shivering and your body using energy to create heat. Mild symptoms: reduce heat loss, add layers of clothing, dry clothes, increase your physical activity, find shelter, and those are ways to avoid the mild symptoms of hypothermia. Also, you would like to avoid drinking alcohol, caffeine, and using nicotine. For treatment, use passive external rewarming warm blankets, which will apply heat to the body. Hypothermia wraps. Also drink warm sugar water. You could dilute it in Jello. And avoid hyperglycemia, which can lead to mental confusion and irregular heartbeat. Stay fueled with simple sugars and carbohydrates. Moderate hypothermia are temperatures between 90 to 95 degrees Fahrenheit. Examples of moderate hypothermia with temperatures through 90 to 90 degrees Fahrenheit are violent shivering may persist, difficulty speaking, sluggish thinking, amnesia may start, sluggish movements, the inability to use your hands, and the individual may also appear withdrawn and stumble frequently. Paradoxal undressing of hypothermia deaths, 20 to 50%. Moderate hypothermia symptoms between 93 to 95 degrees Fahrenheit are intense shivering, muscle incoordination, body movements may appear slow and labored, and the individual may stumble and experience mild confusion, although they may appear alert. The symptoms of severe hypothermia with temperatures between 75 through 90 degrees Fahrenheit are If we reach 86 to 90 degrees Fahrenheit, the individual may experience shivering, which may stop. Exposed skin may be blue or puffy. Muscle coordination may be very poor, and individuals may be unable to walk, confused, incoherent, but may be able to maintain their posture and appear aware of their current environment. Individuals may demonstrate signs of terminal burrowing, which is a hide and die syndrome. Severe hypothermia between the degrees of 82 to 86 Fahrenheit. Symptoms individuals may experience may be muscle rigidity, semi-consciousness, unaware of their environment, and decrease in muscle and respirations. Severe hypothermia between 78 and 82 degrees Fahrenheit. The person may become unconscious. Heartbeat and respirations may be erratic, and the individual may not have palpable pulse and may have dilated pupils. Severe hypothermia between 75 to 78 degrees Fahrenheit. The individual may experience pulmonary edema, cardiac and respiratory failure, death, although death may occur before this temperature is reached. Treatment for severe hypothermia. Our first aid is to perform careful check for breathing and pulse, initiate CPR as necessary, rewarm the body, apply heat to skin, remove all wet clothing, and move the person indoors. Example of active core rewarming is to administer IV fluids and warm bladder fluids. Avoid passive and active external rewarming for severe hypothermia. A further decrease in temperature can occur during the initial stage of rewarming from hypothermia, which is considered after drop. After drop, core temperatures actually decrease with rewarming. When heat is applied to the entire body, the warmth causes the brain to dilate, the blood vessels in the arm and the legs. Cold blood trapped in arms and legs travel back to the core and actually lower the core temperature. Rewarming the core only avoids after drop. Appropriate clothing would be synthetic wool fabric sets, covering head as well as any other parts of the body. Decrease alcohol consumption. Keep hydrated, filled with carbs and sugar. Avoid overexertion, which can lead to sweating and increased heat loss. Person is not declared dead until they are considered warm and dead. Mortality remains high between 38 and 75 degrees Fahrenheit with severe hypothermia and optimal treatment. The signs and symptoms of frostbite are freezing to the skin. Most common sites are the face, hands, and feet. First degree frostbite is superficial, surface skin damage that is usually not permanent. Early on, the primary symptoms is loss of feeling in the skin. In the affected area, the skin is numb and possibly swollen with a reddened border. Fourth degree frostbite early symptoms includes a colorless appearance of the skin, a hard texture, and a painless rewarming. For frostbite treatment, rewarming, if not at risk for refreezing, medications that have the drug code ASA and ibuprofen may prevent damaging inflammation, wound care, surgery, or amputation. Survival kits during the winter should be kept in your back seat or trunk. The items that you should have stored would possibly be a poncho, trash bags, matches, a knife, maybe some snacks, water, gloves, hat, scarf, and wool socks in the event of an emergency. Okay, now that you have been educated about the risks, causes, and how to avoid, treat, and recognize symptoms of hypothermia and frostbite, we will take a 10 questionnaire test. If you are stranded in extreme cold weather, where should you stay? A, in an ice shelter. B, in a car. C, outside by a fire. D, none of the above. The answer would be B. Which of the following signs may go away as hypothermia worsens? Would it be A, slurred speech, B, confusion, C, shivering, D, unconsciousness? The answer would be C, shivering. Number 3, exercise is a good way to increase core body temperature when stranded in cold weather. Would the answer be A, true, or B, false? The answer will be B, false. Eating snow is a safe way to get water. For number 4, would the answer be A, true, or B, false? That answer would be false. Number 5, what should you not do for mild hypothermia? A, move to a warmer environment. B, remove wet clothing. C, wrap in a blanket. D, give hot chocolate. E, you should do all of the above. The answer would be E, you should do all of the above. Number 6, all hypothermia victims shiver. Would that be A for true or B for false? The answer would be B for false. Thawing frostbitten tissue should be done with a heater over a fire. Is that A for true or B for false? That is going to be B for false. Number 8, drinking alcohol makes your body warmer. A for true or B for false? The answer is going to be B, false. Number 9, which is not a sign of hypothermia? A, confusion, B, slurred speech, C, sweating, D, coma, E, fumbling hands. The answer would be D, coma. Question number 10, hypothermia is defined as a core body temperature below. Would that be A, 90 degrees Fahrenheit, B, 92 degrees Fahrenheit, C, 95 degrees Fahrenheit, or D, 88 degrees Fahrenheit? The answer is going to be C, 95 degrees Fahrenheit. Okay. Now that we have ended our session on how to recognize hypothermia and frostbites, please stay warm and stay safe and protect yourself during this winter season. Have a good day. Bye-bye.